Tell us what you do. I have an idea, but I thought that's a good question.
It is a good question. And I like talking about what I do because it is very meaningful to me. I left office practice about 16 years ago and have worked exclusively in nursing homes and retirement communities. For the last several years, 6 or 7 years, I've taken care of the people that live in 4 facilities, which allows me to be at each place at least on a weekly basis. The other role that I have is the medical director, and that's a physician that works with the nursing home staff to develop policies and procedures that pertain to their processes of how they do their work.
And so when Dr. Dentler specifically, as of late, and I talk, we always come back to that about the residents. We always are starting from the same place. And what can we do to make sure that the residents get the best care?
Usually I'm in the problem-solving end of it, where too many patients losing weight. They have to track all of those measures for all of the people that they take care of. And if they see that 4 or 5 of them are losing weight, then we'll talk about that in a manager's meeting and say, are these expected weight losses? Are these people that are dying, or is there something wrong that we should look into? You have a very high-quality nursing staff. You identify these as your patients and almost family members and want to take care of them.
And when you come to work in an environment like this, including our medical director and the nurse practitioners that come in here, we are a family. I mean, the staff are family. You know, we're part of a close-knit group that are there for each other. And I think that's different in this setting than in a lot of professional settings. We're all professional, but we truly care about each other, and we're really there for each other in a bigger sense than just come to work, clock in and clock out.
I think one of the things about this work that I've really enjoyed is that it's very much a team effort, and I like being a team player.
The team of people working in an institution like this, as well as other doctors?
As well as other doctors, but mostly my work here is supporting social workers and therapists and recreational therapists and volunteers and nurses and aides. And I'm glad that I can be a doctor who's part of that. They don't have my skills and I don't have their skills.
Oh, that's all right.
You know, when something happens during a treatment or something that you observe just even walking down the hall with your patient, and you know something's not quite right, you know, you can at least go to the physician or the nurse practitioner and alert them, and they're able to come and assess on a patient right away.
And I feel like together we can take better care of somebody than any of us could do all by ourselves.
Just gonna hit it back to me, okay?
I think sometimes when you are so focused on an illness or a condition, you may lose sight of the whole person. I can't fix very many things here. I used to consider it a real accomplishment to fix somebody's broken arm, but the older people know that I can't fix most of what they have anymore. My sense of satisfaction is twofold. If I can help somebody feel better, and if I can help somebody function a little better, then I've given them a sense of being able to do something that they couldn't do before.